St. Alphonsus Regional Medical Center is located in Boise, Idaho. They are not associated with an academic medical center, so they needed a partner. They partnered with the Center for Health on the Pebble project to basically measure noise pollutants within their facility and other evidence-based design. Basically, the premise behind the Pebble project is you throw a pebble into a pond, it has a rippling effect, and what the Pebble project is trying to do is to measure that effect. St. Alphonsus wanted to measure where the noise came from, how the noise affected the patient's comfort, and patient recovery rates, to see if they could actually first make the patient more comfortable and reduce the recovery time, as well as reduce the time in the hospital. The items that they measured were anything from overhead paging systems to telephones, whether it be in the room or cellular telephones, to the traffic outside of patient rooms, and to compare those with noise levels for any standard patient floor that currently is being measured by the Pebble project. Excessive noise negatively affects the outcome of the healing environment in many areas. In the recovery of a patient, medications are utilized for patient sleep. If the noise level is high, they have measured how many times a patient would need help getting to sleep. If they could simply reduce overhead paging noise, latent noises coming from any of the corridors or any of the processes that they have in place that create this noise, if they can reduce that, they do feel that they can positively affect the outcome and the recovery times. We conducted this study by using a live mock-up. Within the existing patient tower, we were able to demolish an entire floor and use that floor to actually expedite some of the evidence that we were trying to discover on the noise pollutants. A few examples of design and process issues that we dealt with to positively affect the noise pollutants is we included thick sound absorbent ceiling tiles. We carpeted all of the public areas as well as the high traffic staff areas. We eliminated the overhead paging system, which helped not only in patient privacy but also helped in sound pollutants. We initiated decentralized nursing patient care stations as clusters of people within a centralized environment is a noise pollutant in itself. So that not only got the caregiver closer to the patient, it also minimized the amount of noise that would be carrying into the patient rooms. Several of the process changes that were made included having cell phones on vibrate, making sure that the caregivers don't answer the pages within the patient rooms. We also did studies that indicated that traffic such as food service carts, infusion pumps, anything with wheels created noises as they came over thresholds, which also were of discomfort to the patients. So we minimized the traffic outside the patient rooms as well as changed some of the dynamics of those carts. Private patient rooms versus semi-private patient rooms was singularly the most important evidence-based feature that was initiated in the design of the facility. The privacy not only promotes a healing environment, also reduces the infection rates. It helps the families participate in the care. The families spend more time in the patient rooms. Data collected after the renovation was complete indicated two measurable points. The decibel rating of 51.7 was far lower than other institutions measured. The second is in patient satisfaction. The surveys indicated that the patients recovered quicker and were much more satisfied with the lower decibels.
Designing a hospital based on evidence-based design principles is really important in today's setting. What we want to avoid is really designing something based on old processes, and we tend to do that in the healthcare industry. We don't like the way something is happening, but we don't really think about how changing our process, how implementing some technology, and then really melding that with the design can make a better environment. So we actually want to create that healthcare facility that's based on health and wellness rather than one that really creates a stressful environment for patients or for the staff themselves. Clients should learn about evidence-based design because they need to be knowledgeable about that. We know that they want the best possible outcome for the patient. We know that they want a more efficient environment so they can attract caregivers to work there. They need physicians, they need nurses, and they also need to have a return on investment. So they really need to look at what makes this environment the most efficient, what's going to attract patients, and what's going to attract staff. The book, Evidence-Based Design for Healthcare Facilities, was written by staff at HDR, clients from across the country, and it's published by Sigma Theta Tau International, which is the Honor Society for Nursing. We did that because at this time we had enough good examples where clients could tell their story, use these as case studies, and that's what everyone needs to understand. They want to know, where has someone else done this? How could we implement? How can we learn from other clients? And one of the important things is that it's written more like a textbook, and it's written specifically for nurses and healthcare workers, any type of administrators or facility people who need to understand what that process is and what they can gain from that. And then the proceeds from this book go to further nursing education and research through that organization. When reading this book, Evidence-Based Design for Healthcare Facilities, what you can take away from that is the fact that it's based on research. You can look at those research-based design principles, how you can apply them to the healthcare facility, and really create those environments where patients can heal better. And it's a place where you can really see that staff can work more efficiently and we get better outcomes for all.